Well, welcome to season 2, episode 1. Yeah, woo. All right. What substance use looks like. Don't judge a book by its cover. Super cliche. Yeah.
Right.
But relevant, and
It sure
appropriate.
is.
So in our first episode, this is our second season now, going to try to challenge some common stereotypes and misconceptions about individuals with substance use disorder or addiction. Hope is that all of y'all listening, watching, you'll learn how substance use can affect people from all walks of life.
Yes.
We'll dig into that because that's super important. And trying to break down some of those harmful assumptions and foster an understanding of the super diverse faces of recovery. Amani.
Yes. So I am super excited. Well, first, I'm super excited to say we're in season 2.
Season
Woo
2.
woo.
Woo woo.
And also that we received a Pinnacle Award for our show for season 1, which is absolutely amazing. Our Pinnacle Award was from the Las Vegas chapter of the Public Relations Society of America. So big things popping this season, huh?
Yeah, and I guess special shout out to the folks behind the scenes that maybe
Yes.
you all don't get to see or hear
Yes.
about. Specifically Jason,
Yes,
Jason
our
Roth,
producer.
Andrew Peterson.
Yes.
There you go. There's my couple shout outs. But that's not an all-inclusive list.
It's not.
Okay.
It's not. But also, as we go into this episode today, we have a special guest. She brought in the first season with us. We have Sam Ketron here with us. And she's going to be digging into this subject with us, this very cliche subject that we have. So let's take it away.
Yeah, all right. So, generally speaking, our format is maybe 3-ish parts in the 40 to 45 minutes that we roll. First part, quote unquote, breaking the mold. So let's kind of go over some common stereotypes and then how does that affect folks, right? Sam, do you mind starting us off? If you can, what leads to substance use?
So many things. For me, I don't even know. I guess for me, I would have to say childhood trauma. But for other people, it might not be that. You could have grown up in a great household, not have any traumas, had money, not been poor, whatever. But for me, it was like an emotional childhood trauma. So, yeah.
Yeah, absolutely. Amani.
I would have to say mine was trauma as well, but in my adult years, experiencing a domestic violent relationship and whatnot, trying to just numb yourself and self-medicate yourself just to, get over feeling so foolish and, breaking through. Trying to do mental health yourself.
Yes.
That's what I would say. I
Yeah.
was trying to,
Be your own therapist.
Yes, or my own psychiatrist.
Of course. And let's go into sort of I'm not going to say nerdy because that's super judgmental, but like the medical side of things, right? Or from a medical perspective, we generally try to think looking at like large studies over large populations. Let's call it right in the middle. About 50% of what might lead to a substance use disorder, let's call that biologic, aka genetic.
Yes.
Okay, so it's the genes that make you up. Now, what impacts those genes? Ooh, episodes and episodes on that alone, right? But there is this notion that it's passed down, right, from your parents. But also we call it sort of generational, which means it's passed down from your ancestors.
Yes.
And we have evidence to support this. So that's pretty wild, right? Not just your parents, but your grandparents and going back up the chain. So let's call that 50%, right? And then you guys kind of hit the nail on the head. I'm going to say what you guys experienced is your environment.
Yes.
Which is huge. And let me tell you, if I had to choose one thing to get rid of to try to decrease the incidence of substance use disorder in our country, around the world, it would be trauma.
Yes.
Getting rid of trauma. An impossible task, but minimizing and getting rid of trauma.
Yes.
Yeah. The last little tidbit is the substance itself.
Right.
Okay, so this is a confluence. We find that there are certain substances that are more addictive than others.
Yes.
And so you have your genes, your environment, then the actual substance, all that playing together. We have no guarantees. We have no way of really predicting who will given these exposures, experience a substance use disorder, who will recover from a substance use disorder. It is sort of this black box of trying a whole bunch of things to ideally get folks on their way to recovery. Who ends up being impacted? I say everyone. But you guys can attest to that. My experience working with patients and being in the field is that if the person is in the middle of the circle, who is the individual with an active substance use disorder or addiction, the catchment area of all those affected includes friends, family members, significant others.
Yes.
The list goes on and on. But Sam, can you who was sort of impacted, right, by?
So I almost want to say my mom was the focal point, and then, her kids got affected. My dad was affected, and in turn, my kids, myself and my kids were affected. My brother as well, and his kids. So just like you said, it's generational. My mother was the focal point. I found it first in her house, and I thought, if she can do it, I can do it. So I did it, and now here I am. So. Yeah.
Yeah,
I feel just like you said, that's 3 generations right there.
That's 3 generations right there. Yeah. Amani.
That's a lot of information. I'm just still wrapping my mind around. I honestly, when you think of substance use disorder, I really think of it as, like you say, the genetics, and then you think of it as. What was the second thing you had mentioned?
So genetics, then the environment, and then the substance itself.
Exactly. So I've only thought of it as the genetics and your environment. I didn't really even put into play the actual substance being addictive. Yeah. But that is so true because growing up, my environment, I was blessed to have a great environment. And so that wasn't an issue, but the trauma in my adult years was an issue when obviously that led me to wanting to I tried therapy. It wasn't a good fit. I didn't realize though therapy is like dating. You have to
shop around.
You really do to find the right one. And I literally had one. I was like one and done, never doing this again. So let me find something else that works. And I went through a series. It was alcoholism at first, and then I felt like, I was delivered from alcohol, and then meth found its way into my life, and so I thought, just 1 month or whatever, like you say, and then it ended up just being a 4-year span of an addiction because I didn't realize I was, I'm getting the treatment now. I find the treatment and everything. I'm getting the treatment, but I'm not realizing that it's the substance that is highly addictive. And that is a big key factor. So my mind was still spinning around that when you had mentioned that because that is a big key factor into it. And I'm going to be honest with you, a lot of substances, I know it's hard to say which substance is more addictive than the next because also I know I have a highly addictive personality where I'm just like, when I find something, it's, overindulge type of thing. So that was, I thank you for sharing that because that really opened my eyes to see that there are not just 2 parts in it, but it's 3 things that
much like the topic of the discussion, right, sort of breaking the molds, breaking down the stereotypes, don't judge a book by its cover. I'm not saying that this is set in stone. 50% is genetics, the rest, the majority of it is your environment, and then you have the substance, because then that would be the same, right?
Yes.
I don't want to lump everything into it, but along the lines of the actual substance, who am I to say that, for example, methamphetamine is more addictive than alcohol? Right.
Yes.
That's what we think, but the way that we're basing that off of is very technical. It's basically looking at dopamine spikes that happen. If I administer in an experiment methamphetamine and the dopamine spikes really high, and then I administer alcohol and the dopamine spikes a quarter as much as methamphetamine, then we think, methamphetamine must be more addictive, right? And generally speaking, that's kind of how it plays out. But again, not judging a book by its cover, this is not the story for everyone. right?
Yes.
All substances of abuse share that common sort of pathway of they do some stuff in your brain.
Yes.
Now, if you go back to your environment and your genetics, what may be methamphetamine for you, for example, may not at all be methamphetamine for someone else.
Right.
Yes.
It's that makeup. Okay, but like honing in, because we're talking about these sort of breaking down, judging the book by its cover, a little bit on substances. What about stereotypes that you all encountered? Sam.
Dun, dun, dun.
Dun, dun, dun.
Like, so I never really pay attention to what other people thought of me. Honestly, not until I was homeless, but I feel like it was a lot of the stereotypes that I had about myself or about other people in addiction, which is crazy, right?
Not crazy.
Here I
Not
am.
crazy, but yes.
Here I am, homeless on the streets, but I'm judging the next person that's homeless on the streets. Which is just really weird. So when I was pregnant with my third baby, I had a lot of stereotypes about being pregnant in addiction, right? Which kept me from going to the doctor for a really, really, really long time. I don't think I went to the doctor until a month before I had him. And I guess it was... you don't want to be looked down on. You don't want to be shamed.
Yes.
Drug addiction already has a lot of shame to it, whether people like to admit it or not. It has so much shame. And, you taking the step to go to the doctor while pregnant and using, and you might be going there to get clean. You might not. Like, it's a really hard first step to do.
It is.
That has lasting effects on not only you, but the baby, so...
Yeah, and so that was going to be sort of the second part. So then those stereotypes, how did they affect your journey in recovery?
Yeah.
What was and maybe you mentioned this, but what was the biggest one? Okay, so you were pregnant, you didn't go, you didn't want to sort of engage until very late in the pregnancy. What was the number one? If there was a number one, was there a number one reason of not happening?
Well, I was giving him up for adoption, so...
Okay.
So I had a friend pick me up and take me to California. I didn't want to have a baby that was addicted to meth. Nobody does. But it was mainly because her sister was going to adopt him, so...
Yeah.
Yeah.
So, that's huge.
Honestly,
Yeah.
if it was up to me, I probably wouldn't have gone.
Right, at all.
Yeah, at all.
At all. Yeah, hopefully we'll get time to sort of loop
Absolutely.
back around to that, because that's one of the key takeaways I hope we get from an episode like this. With the Empowered program and whatnot, our focus is pregnancy and postpartum, right? And oftentimes we find that those folks are the most stigmatized, and right. But go ahead, Amani. What about you for stereotypes that you experienced, and then how did that affect your journey?
So, getting down to like just the nitty gritty, just being 100% real here. I don't fit the stereotype for somebody who consumes methamphetamines because the first thing was my size. They always...
I'm not gonna lie. I thought that about a lot of people in my addiction. I did. How are you 400 pounds? Sorry.
No, but literally, it was my size. They were like, "Wow, you? No, ain't no way." No, I do. It just affects people differently. Even like to the point where just like, even just to be so blatantly honest, race.
Yeah, your skin color and the drug you use.
Yes, because
I thought about that too in my addiction.
No, honestly, I didn't even know at one point that it was really an epidemic, a methamphetamine epidemic with African Americans. I did not know that at all. I thought it was just not African Americans until I actually had met somebody, and I was like, "What? Is that, cocaine?" And he was like, "No, this is," and I was like, "What?" And so that was always a factor as well. Obviously now, being in that world and having had used meth for over 4 years, you do see that there are all various types of people. Just even for me, having been able to have gone to school, get a degree, and everybody in my family being educated, because I was the last person in my family to get a degree. My little sister got hers before I did too, which is a blessing. And so just coming from a family full of people who are, who have college degrees, and me having one at this point, and it's like, oh, you're using meth, it's a very big stereotype. And so that's why it was super hard for me to even reach out for help.
Sure.
Because that's all that's going through my head. How do I ask for help?
What are they going to think of me?
Exactly.
Are they going to turn me away?
Exactly, all of that. What are my parents going to think?
Right.
Like this
it's going to change everything once I let them know, hey, this is what's happening.
Exactly. And they're gonna think, this is not how we raised you. Where did this come from? I mean, granted, my immediate family, I'm the only one who had battled with a substance use disorder in my immediate family. But if you take that circle a little bit outside further, there is substance use disorders that run rampant in my family that, that a lot of people had suffered from. So like you said, it's those genetics, and then it took for the environment later on, to end up. But yeah, I didn't know, because of the stereotype, I didn't know how to reach out. I didn't know who to ask. At the time, I was teaching, substitute teaching at the time. So I'm like, how do you really? How do you really?
My job.
Reach out? No, everything is running through your mind, because teachers don't have addictions. No. People who go to school, you're not supposed to have addictions, or if you do, it's not supposed to consume your life to where now you've lost everything. It's supposed to be something that you keep on the low, that nobody can tell that you're using, type of ordeal, right? I mean, that's the stereotype or stigma. So that's what I was going through. So it was so hard. So it took for everything to go for it to come out, because I was just too scared.
It was going to come out eventually.
Yeah. I should have said something, though.
Yeah. Okay. Like 30 different things to unpack.
Right.
But what's the big takeaway that I want to comment on is, I think it's what you both have mentioned is a really good segue into our sort of next section, which is beyond appearances, right? How does substance use manifest? What are some signs that often get overlooked? How can we help folks recognize, et cetera, et cetera? Well, I mean, it's basically the takeaway from what you all are saying is the stereotypes when it comes to substance use pretty much don't do anyone any favors.
Yes.
Because they're exactly that, stereotypes. And oftentimes they are not accurate.
Yes.
Right.
They are not accurate. And the other thing I heard was that those stereotypes that, one, aren't accurate, they get in the way of recovery.
They do.
Really do.
Look, as if recovery is not challenging enough, now we have to add more obstacles with these different stereotypes. What I also heard was that there was internal stereotypes and then external stereotypes. So at Roseman University, we have the College of Medicine, which is a big deal. And so what I'm hoping is with talks like this is that we can have some impact, right? That I can help have some impact. You can, and Sam, you can, and all of our viewers and watchers and listeners can have some impact on the future clinicians of tomorrow. Because without them on board, I promise you the stereotypes will continue. The judgment will continue.
You're right.
The stigma will continue. But what that ultimately means is lack of treatments, barriers to treatment, which in this day and age of substance use equals death.
It does.
Right.
That's it.
It does.
Point blank equals death. Why do I say that? Well, fentanyl and everything. One pill can kill, one little sprinkle, methamphetamine, our drug supply. You can pretty much assume that our supply of methamphetamine now
Has
fentanyl in it, whether you want it to have it or not. So there you go. But in your experience, what were the signs that you feel were overlooked? Like what is it that folks should have caught on to when you're either engaging with the healthcare system or family, anything out there for our viewers, right? Our viewers and listeners. Hey, oh my gosh, I do have a friend who sometimes, my gosh, is this what's going on behind the scenes? And does that explain X, Y, and Z?
Can I start with that?
Mm-hmm.
I know that my mom, she takes my substance use disorder. She takes it very personally, and it honestly, it breaks my heart because it has nothing to absolutely do with her at all. But
She's perfect.
She really is. She's such a great mother. I'm blessed to have a great family. But my mom took it the hardest because one thing she always said is, how did I not know? I knew something was going on. I knew something was going on. I knew you were off. I thought there was a bipolar commercial that was on, and it was literally, it was like up all night. You know, my mom's like, that's you. You need to go get tested for bipolar. But she knew something was going on, and she couldn't put her finger on it. And she said, I thought it was drugs, but I wasn't for sure. And I would have to say, if you think, ask. If you really think, ask.
If you think, ask.
Because I think also, I don't know. I mean, you know, maybe if someone asked, maybe it would have been a little bit.
Maybe you would have.
Maybe it would have been
word
like,
vomited. Yeah.
Hallelujah. Thank you. I'm glad somebody
I didn't
asked.
have to bring it up. Thank you.
Exactly. Yeah, I know I tried reaching out a little bit to quite a few people. I would start the conversation like, hey, there's something I have to share with you. And they're like, what? And then I'm like, oh, never mind, because I didn't want them to think differently about me. I didn't know where the information would go. I didn't want to feel judged like, oh, you know, now you're just another drug addict, quote unquote, or, you know, now we're not going to take you seriously. I worked so hard. They say that you can work your lifetime doing great things, and it only takes one bad thing to knock all that great things that you did down. Yeah. And I was worried about that, but I ended up doing that myself.
Sam, how about you?
I would say when I'm in active use, I start to withdraw. And I'm like a very to myself person anyway. So if I stop coming to work, you'll know. If I start calling out frequently, you'll know. If I stop talking to, you know, my people, you'll know. So I always try to, you know, text somebody back just in case, you know, if I don't answer, something's wrong. Mainly withdrawal. Yeah. Withdrawing from society and from people and kind of like beating myself up about it.
Yeah. Okay. How about this? How can we do a better job at recognizing when someone needs help? And I'm going to say we, how about it comes from me, the healthcare system. How can we do a better job? I want to say you can't, right? But only because, like, you can be there and you can be supportive all you want, but, like, that individual needs to, you know, obviously want it. You know, don't be judgmental. Don't be, you know, catty or whatever. Like, talk, like, they're humans, too, and they're going through it. So just be there, I guess. Yeah.
I know I had faced a situation, I've probably spoken this before, but I know that because I don't fit, quote unquote, the stereotype of somebody who looked like they used meth, it was something I disclosed all the time anytime I went to the hospital, just so that they can know. I don't want to die. So if my meth usage was complicating something else, I just needed them to know so that they can treat me and know what else is in my system. And I remember I had told a nurse that I had used meth. And I guess she assumed that I was using with the needle, the meth. Okay. And so so when she went to go take my blood, she was like, I'm definitely scared of needles, okay? And so I did act up plentiful. Yeah. But what she did do is I was asleep, and she came and woke me up, like, taking it. She didn't even tell me, like, Amani, I'm going to take her. She just, like, it's a needle. So I'm like, what the, you know, and I act a fool. And she's like, I thought you said you had a drug. I thought you said you used drugs. And I'm like, what does that have to do with me getting a shot?
And a nurse, too. You know, Google is free.
That girl.
You can search anything you want on there. Like, not every addict administers drugs the same.
That part. I'm just like, what the, like, I'm just thinking, why did you say that? And then I'm like, oh, not even the case, woman.
Yeah, and you're in the hospital, so
Yeah,
okay.
I'm vulnerable first of all because I'm there taking myself because whatever I feel like it's detrimental to my health, and then I disclose something very personal with you that
Yes.
usually
And
nobody.
the minute you did, they judged
Yes.
you.
Yeah, super bummer. Super bummer. It is not easy for folks to disclose without being asked or without sort of prodding. Okay, so that takes a lot of oomph. So then you took all that oomph, you disclosed, and then you got beat over the head because of it. One of the huge mismatches between how we end up caring for folks with substance use versus how we should
Yes.
care for folks. And I'm going to take some
Yes.
time to talk about that. Going back to what are some of the signs that folks can look for, and what you had mentioned with maybe family members or friends, those kinds of things. I'm going to approach it from a perspective of what we call parity, which means equal. Comparing the parity for physical health compared to mental health. We are by no stretch of the imagination there.
Yes.
Mental health is still looked at, viewed, treated, assessed, diagnosed different than physical health ailments. Okay. So you all had mentioned some, hey, maybe my friends coulda, or maybe and that's the question that I had asked. Yes. I was being a little deceptive, because I think that while all of that is amazing and fantastic, I'm an idiot and I have no idea what advice to give folks out there on how to navigate that, because we're talking about something that is so nuanced. Someone asked you, and now you've ruined the relationship. Your best friend of 30 years.
No, you're right.
is
You
on
never
the
know
outs
how somebody's
because
gonna
how
react.
dare they ask you, oh, Amani, but at the end of the day, I'm concerned because I'm noticing this, this, and this. Now you're defensive. Now this. So I won't even pretend to know what to tell folks out there, what signs to look for, because
Right.
I almost want to say it's not your job.
It's
not.
yeah, I'm
It's
gonna
not
be
your job.
honest. It's really
And it probably
not.
won't help,
And-
honestly.
Yeah, you could drive
that's
them
what
further
we-
away.
So that's what we find,
Yeah.
is that on average, it doesn't. And so I mentioned this notion of parity. What would you guys say in the same exact thing if I said, oh, what would be the signs and symptoms that you would want friends and family members to look for if you had high blood pressure or if you had diabetes? You'd probably go, what?
I love this speech.
Isn't that what healthcare? Isn't that what my primary care clinician is supposed to do?
No, you're right.
Hell yes, it is, and that is exactly why that's the perspective I take on identifying the signs. How do we best engage with folks? How can we recognize it for substance use?
I love it.
I want the onus to be on us as clinicians, and all of the major health authorities, societies, organizations, I'm talking the massive ones like the American Psychiatric Association, the American College of Obstetricians and Gynecologists, the Society for Maternal Fetal Medicine, SAMHSA, which is the Substance Abuse Mental Health Services Administration, the United States Preventive... What do we say in this day and age for substance use? How do we recognize the signs, and how do we offer help and basically identify those? It's super simple. I'm going to tell you all. We need to ask the questions.
Yes.
We need to ask the questions. In the world of mental health and substance use, at least as of 2025, we're early in the year 2025, we do not have a way to image or run some sort of test, whether it's blood or biologic, to say this person has substance use disorder, this person has anxiety, this person has depression. All we have in our toolkit is questions.
Yes.
So specifically for substance use, and remember, I named all those organizations. The best practice guidelines say for every new patient you see, and thereafter, you should be asking about mental health and substance use issues. I'll give you a specific questionnaire that we use all the time for specifically pregnancy, something called the 5 Ps. We say it's something that's been validated, AKA like research has been done and shows that it does a really good job at identifying. and it does a better job at something else that folks think is the way we should be screening, which is I'm going to have you pee in a cup and I'm going to test your pee for substances. Do not do that. It's a violation of practice guidelines. It's a violation of moral and ethical sort of, practices that we have.
Never knew
and
that.
Fundamentally, without explicit, written, verbal, signed. I mean, we have this wild, eons-long conversation about all the risks, benefits, side effects, alternatives of me testing your urine, what we call informed consent, after I get that. But if I don't get that, it is actually a violation of your Fourth Amendment rights to test your urine, and that was decided on by the Supreme Court.
Who knew?
So we should not be doing this. And instead, I'm basically letting y'all know, easy questions. Ready? 5 Ps. Did your parents have an issue with alcohol and drugs? 1 P, parents. Okay. Biologic. Yeah. Do your peers, friends, second
Love
P,
it.
have an issue with alcohol and drugs? Okay. Does your partner have an issue with alcohol and drugs? That's the third P. Do you yourself in your past, have you had an issue with alcohol and drugs? Fourth P. And then do you presently use substances or alcohol or have an issue presently? That's it.
I love that.
And then based on those answers, yes, no, 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 yes, we sort of risk stratify. But there it is. It's 5 questions. We ask those. Based off those answers, we do some stuff.
That's amazing. And I love that so much better because I know when I was pregnant and had to go to, and I was actively using and had to go to the doctor, I would schedule my appointments 3 days out so I could make sure that I passed my urine analysis.
Ding, ding, ding.
Sometimes those things, I mean, I don't even know if clearly they work, right? But when I was pregnant with my first baby, like I was using every day, all day long, and I would go to the doctor regularly. She never said anything.
See?
Maybe she saw it, maybe she didn't, but she never,
the fact is,
never,
she never
said
said
anything.
Yeah, we have, and this is
crazy.
what we find in practice, right? What we find in practice is that some folks do get identified, and then nothing happens. It's almost like a don't ask, don't tell kind of situation.
Yeah.
It's a what the heck do I do now sort of situation. Folks in primary care and specialty care outside of psychiatry and addiction medicine, they've had minimal training. I do not blame them at all. Minimal training, minimal exposure, right, on what to do when you identify someone with substance use. I get it. I get that these are some of the sort of obstacles for folks becoming comfortable with asking. But until we ask, people are going to continue to die. The numbers show for folks in this country, the United States of America, if you're between 10 and 50 years old, the number one cause of death by far and away, and not even close, we've talked about this before, it's not guns,
No.
it's not heart attacks,
No.
it's not stroke, cancer, or diabetes,
It's not.
car accidents, it is by far and away overdose. So we are not asking the question of something that is killing the most folks between 10 and 50. And I'll tell you, for a country's health, in every which way, that is a very important patient population.
It is.
10 to 50-year-olds, and we're just a plane a day,
Yeah.
a plane a day going into the ground
Yep.
with the number of folks. We talked about the questions, but also what would be my other sort of follow-up to that on how do we best recognize, right? I'm putting all stereotypes aside. And why am I going to say what I am about to say? Because this is what basically tries to curb all the biases and stereotypes associated with things like asking about substance use. Looking at Sam and being like, oh, for sure she uses cannabis. Like, that stuff doesn't work. It's not real, right? Yes, for some substances, maybe we have some inkling of a clue, but that is still so stereotypical, right? So we ask the questions, but then the key is, when do we ask questions and who do we ask them of? Simple. Everyone.
Yeah.
All the
If
time.
you're human.
Yep.
Every time. If you walk in and I'm seeing you for the first time, I should be asking you, regardless
Yes.
of Race,
Yes.
body habitus,
Yes.
weight,
Yes.
socioeconomic status.
Yes.
The list goes on. You can name me every single variable, and that's maybe something that we'll get to in another episode, right? What's some of that stigma look like? Who can? Everyone. That's the short answer.
Yes.
Is everyone. So I can't. And so when you come in and I have presented you with new patient paperwork that says, hey, Sam, so can you fill in your last name, your first name, your date of birth, and your address? Do you have any significant medical history? Have you ever had any surgeries? Do you take any medications? Does your parents have any problems with alcohol and drugs? Do your peers? Does your partner? Do you in the past? Do you have any allergies? Do you what kind of transportation do you have? I have now just included that in hopefully as non-judgmental of a way, a way for you to mark whatever you feel comfortable marking, right? And if you were to mark, so folks ask me all the time, right? Clinicians ask me all the time. Well, people
They can just lie.
People can lie.
Yeah. But
yeah.
but maybe one day
can.
they won't.
Yes.
Yeah. Why are we operating off the assumption
That somebody's
going to
lie. Of course they're gonna lie.
Well, that's because we know about the stigma that we have in place, and that's why people are going to lie. Because I lied up into a point where it was like, once it was out, then I was open. But yeah, I covered it up too because I didn't want to be looked at as somebody who was using or
I lied
getting
for 10 years.
Yeah.
15, like, come on.
Yeah. Yeah.
But, one day, they might decide to be like, hey, this is really affecting me. Maybe I should be honest.
It happened to us.
Hello.
Yes. Look, a non-judgmental conversation starter is key. You're dealing with folks, you both have attested to this, that have had traumatic experiences. My guess is that some of that trauma has been with the healthcare system. Okay, so now I'm asking you some stuff, and you might lie to me. It's a self-fulfilling prophecy. My shortcomings for the past 40 years have led to, more often than not, this notion that, when it comes to mental health or substance use, those folks can just lie. Well, they could have lied when they wrote down their surgical history.
Yep.
Why are we only talking about them lying about substance use? Anyhow.
That is true.
So that's further perpetuating. It's not a valid argument. The reason that we say it's validated is because research studies show that folks don't lie. They don't lie, and that there's actually more shortcomings with a urine drug test. This is exactly why all those major societies say don't do it. You talked about it. Well, I know if I'm using methamphetamine, I'll wait 2 days.
3.
There are clinicians that order a urine drug test. I'll tell you, I'm seeing this firsthand,
I
and
can
have
imagine.
no idea what they're ordering and what substances would trigger positive. That's just one shortcoming that we've mentioned, right?
Right.
The detection window, and then what are we even looking for, right? I'll let you know, on all of our standard, you pee in a cup nowadays, right, which they're calling is sort of this, it doesn't include fentanyl, okay? So someone could be using 50 milligrams of fentanyl a day and is on the brink of death.
And nobody would know or detect it.
Nobody would know. Anyhow, coming back to it, that's exactly why we talk about doing things that are sort of evidence-based. To date, I talked about this being early 2025. The single best strategy we have to identify substance use
Ask
is to
questions.
ask questions and ask the ones that have been validated. Not, I'm making up my own
Yes.
questions.
The
I've had
Ps.
folks, so something for during pregnancy and postpartum, something like the 5 Ps. Because I have folks who say, I ask questions. What's the question? Hey, Sam, so you're 30 weeks pregnant. You don't use drugs, do you?
Oh, that's very leading.
No.
I'm going to say
No,
no,
I-
because
right.
I think
Sure
that's what
don't.
you want me to say.
Yeah, so we have to use validated questionnaires, and we have to use them for everyone. Every single person walking through the door. That's the best tool we got.
I love it.
That's it.
You know, as I was listening to you speak, I was thinking about my past doctor's appointments. I'm like, nobody screened me.
Did you get screened with a questionnaire or questions?
Oh, man.
So you went in a month before,
I'm-
right? You said you went in late.
That
You went
was
in
a
late.
long time ago, and that was in California. I do not, because I don't believe that they questionnared me because I was quite honest in that one, because I didn't want I had him a month early, so I didn't, just in case anything like popped up, I didn't, want to be in trouble for it. I wanted them to know just in case he was affected, and he was. I guess he's like deaf in one ear and has Tourette's, which we'll never know if it was from the drug use, right?
No,
but I
won't.
did, since I was giving this baby to somebody, I was like, hey, this is what I've been doing. I just want you to know, no prenatal care, whatever. But I don't recall them ever. Maybe it was in the forms, maybe it wasn't. And with my most recent pregnancy, I can't recall it there either. I do remember filling out paperwork, but I was also, at inpatient rehab where, the doctor that we were connected with was connected to the rehab, and so it was like he already knew. He was a chill guy too, so it wasn't really bad. But it might have been there, but did it stand out? I don't know.
Sure.
I don't think so.
Sure. And that's kind of key.
Yeah.
The fact that it didn't stand out,
Yes.
That leads me to believe, more often than not,
That it wasn't there.
It didn't happen.
That's what I'm thinking.
More often than not, that it didn't happen.
But I also
because
feel like it's in every time you go to the doctor, even for my daughter, like they ask the mom's medical history, and I still put that I was on buprenorphine when I was pregnant with her, and I also did heroin the first 4 months. So I feel like it's always there in a certain way, right?
Yes.
Maybe not all of the P's, but it's, the history is there.
Yeah. Okay, so really good point, right? There are hints of it. So, like, you'll see new questions that say, like, do you use tobacco? And maybe some might say, do you drink alcohol?
Yes.
But specifically, why am I mentioning something like the 5 Ps? Because what we find is those aren't really evidence-based questions.
Right.
Versus something that is sort of validated. Those are the questions we recommend.
Right.
Because the other ones don't give you the whole picture. They're not asked in a certain way and whatnot. Okay? So that's why we're moving more towards these, if every office is asking these, and that's what we do particularly here in Nevada, right? So from the state level, we are encouraging all clinicians that engage with pregnant and postpartum individuals, ask the 5 Ps. So that we can all be on the same page. We all know how to interpret it. We all know what to do, right? If one is yes and this is no, and things like that. But you had mentioned that you weren't screened specifically, Amani.
As I'm thinking, when I was pregnant, I do remember having those screenings vaguely.
Possibly.
But no, as you were speaking, Sam, I noticed that the questionnaires on the paperwork, they do ask those questions.
Yeah.
So, yes, they did have those there.
Wonderful.
As far as somebody taking the time
to talk
really,
about it?
Yes.
Okay.
And
Next steps. Next steps. But I say baby steps. We've been struggling for decades when it comes to mental health and substance use. I know people are dying every single day, and we could be doing better. But baby steps.
You're right.
Patience.
You're right.
But I love one of the things that both of you have said is I disclose. That's super difficult, a whole episode on its own. But for everyone listening out there, I know you might get repercussions from disclosing.
Yes.
But just maybe think
It's
of
worth
yourself
it.
and your little one or whatever it is.
In the long run, it's so worth it.
I know.
I know. A lot of times because I just, hey, I've used meth, or now it's, I used to, I suffered with the meth disorder in the past, but I know a lot of the times back in the day when I would say it, I'm like, oh. Because I ended up having a CPS case because I disclosed that information.
Yes.
My kid did not have it in their system, none of it, but ended up having a CPS case. But luckily, when you're living right and you are transparent, you're being honest, it gives people a way to work with you, and everything worked out for the good in the end, honestly.
Yeah.
So I always say, regardless.
So we say a success story. Yeah. All right. So in closing, Sam, give me your one-liner. What do you want folks to take away when it comes to judging a book by its cover in the world of substance use, stereotypes, whatever it may be?
Oh God, I don't know. Amani, you go first.
Okay, Amani will go first.
I'll go after you.
Okay, I want to say, I know this may seem a little off subject, but I know it's a stigma of mental health, getting care for your mental health.
Yes.
It seems as though you have to have money, you have to be rich, in order to get the proper care for mental health. That is not true. They look at your insurance card. They have options for you. Go seek mental health. It is not for the elite people only. It is for everybody, because if you don't, it's a whirlwind downhill sometimes if we're not taking care of ourselves. So if we go to the doctor, we need to go see a therapist, psychiatrist, whatever we need to make sure we're good.
Also, let's stop diagnosing while people are in active use. That's
part.
wild. That's my one-liner.
Yeah, there it is. So there's the one-liner. My one-liner would be, I'm actually going to stick to my sort of guns when I say we should not be judgmental.
Yes.
Right.
So I also want to be non-judgmental towards folks that do have stereotypes, do have biases, and do have assumptions. I'll speak for the healthcare system. Baby steps.
Yes.
Continue to have those for now, but just please universally screen
Yes.
with questions.
Yes.
So that hopefully we could start moving the needle towards
Yes.
working out of the stereotypes,
Yes.
working out of those biases.
Yes.
All right.
Because substance use has no lick, no generic
Does not
lick
discriminate.
to it. It doesn't. It really doesn't. It loves all.
No, it doesn't. Let's talk about that in a future episode. Yeah. All right. Do you want to close us off, Amani?
Oh, well, thank you so much. We really appreciate you guys tuning in to our first episode of Empowered
Season
Voices.
2.
I know,
Yeah.
season 2. This is just so amazing. We thank you, Sam, for being on this show and just being and sharing your story was just so amazing. We appreciate you always. I love being on here with you anyways. And obviously, just your story is going to share and touch everybody. Both of our stories are, I know for a fact.
I hope so.
Mhm, we know so.
It does. It does. Yeah. So yeah, thank you for listening or watching
Yes.
to the premiere episode of Empowered Voices Season 2. Be sure to subscribe wherever you get your podcast as another episode drops in about 2 weeks. Also, don't forget to rate and share with others who may find our information and discussion topics helpful. Thank you both.
Thank you.
Yes. If you live in Southern Nevada or in Reno, Carson City, Churchill County, or Lyon County in Northern Nevada, or Weber County in Utah, and you're pregnant or recently had a baby and using opioids or stimulants for any reason, there is non-judgmental help available to you. No referral or insurance is required. Visit empoweredmoms.org for information or to request services. If you live outside these areas, we encourage you to find resources in your community.
Empowered Voices is a podcast production of the Empowered program at Roseman University College of Medicine, supported by the Centers for Disease Control and Prevention's Overdose Data to Action grant through the Southern Nevada Health District. This project has been funded by grant number NH28CE003534 from the Centers for Disease Control and Prevention. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by the Southern Nevada Health District, CDC, or the U.S. government. Hosted by myself, Dr. Farzad Kamyar, and Amani Wilson. Executive producers are Dr. Andrew Peterson and Jason Roth, with production assistance by Rachel Mack. Recorded at the Video Podcast Studio in Las Vegas, Nevada. For more information about this podcast and past and future episodes, visit empoweredmoms.org.